Welcome to our school hospital. At Rehab Station, they learn about athletic training, physical therapy, occupational therapy, speech therapy. They get to work with all the equipment that is involved in taking care of those patients during those careers and that career path. Here's just a little bit of equipment that they get to use. There is much more, and they all get to learn how to use it and what it's for. And this is lab. Here at lab, they get to learn how to do tourniquet tying, how to do a one-handed pull, and also a taste at phlebotomy. They also get to use the VR headset with the computer so that they get to learn how to do PCR lab testing for the flu. This is radiology. They get to look at a variety of different images. This right here is an illumination. And so there is a skull, and you can see where the shunt is at and the clip. They get to learn about all kinds of different radiological things like IV pyelograms, CTs, MRIs, and look at all the different images and see what's on them. This is biotechnology, where they get to study different things, like they get to do a protect the pill lab, they get to do EMG testing. It's like EMG testing, but it's like a muscle test. No needles are involved at this station. This is patient services. They get to learn about insurances, dietitian, various different ancillary careers. Here's our patient board. It has on there all of our different patients and what they're in for and the different floors that they're at. This is Central Supply. They're the ones who hand out all the equipment to the different stations. They also use this glitter bug germ thing so that you can look and see under your hands what is dirty and what is not. They also learn about PPE and how to put it on. This is pharmacy. They learn how to count pills. They have different fake medications. They are painted beans, but they get to learn how to count them, how to make oral suspension. They grind up the make-believe pills and make an oral suspension out of Smarties. This is ER, probably one of our favorite stations. They learn how to do chest compressions on our friends over here. They learn how to do stop the bleed for either a laceration or a bullet, and then an all the way through bullet. They learn how to pack the wounds and apply a tourniquet so that the bleeding does stop for a trauma response. They will also learn how to use an AED and a choking vest, how to do the Heimlich maneuver properly. Over here, we have Marvin. They learn how to apply a cervical collar. They will also learn how to find the fracture on this leg and how to apply this vacuum splint to the leg. Here is surgery. They learn how to do proper knot tying for suturing And during surgery, everyone will get the opportunity to put stitches in the arms and the legs. Everyone has the opportunity to learn how to do stitches. CCU. At CCU, you learn how to run an EKG. You do use the VR computer. It's a 3D model that walks you through how to do ECGs and EKGs and where the 12 lead placement goes. That best prepares you for the CTC for when you go to the EKG course. In Med-Surg, they learn about the step-down patients. So they learn how to monitor blood pressure and pulse and temperature. They also get to use this auscultation vest that has a specialized stethoscope and a diaphragm that can listen to all the different types of respiratory ailments that is possible. So they listen for wheezing, for stridor, and fine crackles.